Assalamualaikum and good day to our respectable lecturer, Mr. Elias Sulaiman Mohandas and fellow classmates. We are from Group 1, or known as Wonderpets. We'll be presenting a proposal entitled The Correlation Between Overweight and Obesity Towards Chronic Diseases and Stress Among Workers in Port Dickson District Health Office. Before we carry on with the presentation, I shall introduce the associate behind it. Our group consists of 4 members, which is Razatu Fahida binti Razak, me, Wanura Aisyah binti Wan Muhammad Huzaifah, Muhammad Qayyum bin Sunawan, and Esa Zerbisikar. So now we shall proceed with the presentation with my friends taking over.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Qayyum bin Sunawan. So today I want to give some introduction about our research. Healthcare workers and professionals are anyone who engage in activity with a primary goal of improving health. In accordance with the demands of their population they serve, they investigate, diagnose, treat and prevent human illness, injury and other physical and mental disabilities. However, when it comes to the well-being of healthcare workers, insufficient attention was paid to them. Many of them have lost sight of their own personal health as a result of their workload and taking care of others. Working on a time crunch, for example, may force practitioners to be on their feet most of the time and only eat fast food, conserve time. And as a result, they may be suffering with a weight issue and bad lifestyle. Furthermore, the irregular hours they work and the stress they face at work may make them prone to being overweight or obese. Overweight and obesity are caused by the formation of unhealthy excess body adipose tissue over time as a result of a positive energy balance. Aside from specific genetic problems linked to obesity, recent epidemiological trends have suggested that environmental and behavioral factors are also to blame. Obesity and overweight are substantial risk factors for diabetes, cardiovascular disease, and cancer, among other chronic diseases. Cardiovascular problems are linked to excess body weight. Working conditions for healthcare personnel can also be a contributing factor to poor lifestyle choice. This is due to the fact that they are too physically exhausted to take the time to make a good lifestyle decision, such as cooking a great healthy meal that is high in nutrition, and instead of go for easier and faster option while feeling guilty about their inability to take care of themselves. Taking care of others' health is important, but first and foremost, one must ensure that one's own health is being taken care of. If a person's health is ignored, they will not be able to give their best effort. Lack of personal time may lead to an unhealthy lifestyle, and as an outcome, healthcare workers may be putting the health at danger of the chronic disease. Now we are moving to problem statement from our study. The problem of overweight and obesity is one of the primary immediate and long-term health challenges in modern society. Obesity is linked to a number of chronic conditions, including type 2 diabetes, high blood pressure, stroke, coronary heart disease, and numerous cancers. Obesity and overweight are caused by a variety of factors, but at a societal level, they are often attributed to an energy imbalance, which is we are burning less energy than we taking in. Meanwhile, stress is a reaction to or a result of an action or event that puts a person under special physical or psychological demands or both. Small quantities of stress can be beneficial by motivating people to achieve their goals, while excessive stress can have a negative impact on a person's health and work performance. The researchers were inspired to conduct this study to see if being overweight or obese is linked to chronic disease and stress among healthcare professionals. By the way, is there a link between body mass index statistic and chronic health condition among healthcare workers in Port Dickson District Health Office? Second, is there anyone in the Port Dickson District Health Office who is considered burnt out? Thirdly, what are the true cause of their health problem or mental state? Finally, has any action been taken care against healthcare personnel who cope with chronic illness and stress? My fellow friends will discuss about it later.
So hi, my name is Wanura Aisha and I shall continue with the objective of the study. So the purpose of doing this study can be broken down into several objectives, which is the first one is to recognize or categorize the body mass index status of the workers in Port Dickson Health District. So to see whether the employees working over there are at their underweight, overweight, healthy, or maybe obese state of health. So for the second one is to find out or discover the health problems of chronic diseases among workers in Port Dickson Health District. So this is to see that in a way that we may observe whether the employees are suffering from chronic health diseases or the employees working over there are at their best health. So for the third one is we want to identify the relationship between overweight and obesity toward chronic diseases. So this is more to observe if the weight status has a correlation to chronic diseases upon workers. So for the fourth one is we want to identify the relationship between overweight and obesity towards mental health problems, the same way with the third objective, but to see if the weight status has a correlation to mental health states of the workers. So in a way, these study objectives are what we are trying to achieve in finding the solution to it and guiding us in carrying out the research. So next, we shall move on to the significance of the study. So in this study, we are hoping the outcome of the study will help the organization or the management in several ways, which is the first one is to determine the health status of Port Dickson Health District personnel. So by knowing the health status of each employee, the management hopefully will provide or delegate working accordingly. So this itself will help the management to recognize those who are able to work at the best performances and those who are unable to do so. So next is sorting workers for the help they require for the safety of their mental health by implementing wellness programs. So after knowing the employee's health status, the management can provide or create a solution to improve the quality of working environment so that the workers are able to be more productive at their working state. So for the third one is this study is also aiming to help the management in determining the background health of the employees so that the management can firsthand in helping the employees in keeping them back on their health track by providing a program or even create a rotation working adjustment. So for the fourth one is this study is hoping in assisting the management by producing even more competent worker with good quality lifestyle and work in a stress-free environment, hence helping the organization in running with efficiency and smoothly. We are hoping this study will come out as something valuable towards organization in managing the workers or employees, especially in their health status needs that will contribute to their working performances.
I am Isaza bin Sikar for presenter today. So I will present for the fourth limitation of study and previous study. So we go first for the limitation study. First limitation study is about a time for taking fasting blood sugar because requiring patient to fasting around 8 hours and not being applicable in the afternoon. The second is data collection. The requirement for morning sampling will obstruct the data collecting process because some employers, particularly those involved in dengue control activities, carry out control activities such as fogging in fields from 6 a.m. to noon. Therefore, it can be affected. This blood sampling process cannot be carried out at a time when sampling with other staff and requires several different seasons. Last limitation in this study is about the cost. The data collection process will also involve high cost as the study samples involve total numbers of 96 samples. For identifying the health status of chronic disease of staff will require borrowing the expertise from medical personnel involving the activities of blood pressure, cholesterol level tests, and blood glucose tests as previous study. So there are several vast studies related to our study to help us answer the question or the objective of our study, such as body mass index. body mass index is the way to define as a person weight in kilogram and divide by the square of their height in meters. BMI is a simple and inexpensive way of determining weight categories such as underweight, healthy weight, overweight, and obesity based on Center of Disease Control for Prevention (CDC) 2021. But the second is health consequences such as cancer, breast, endometrial, ovarian, cholesterol. Also is type 2 is diabetes, hypertension, stroke, congestive heart failure, asthma, chronic back pain, and increase of disability are some of the comorbidities associated with the overweight and obesity. But the last is our previous study is mental health implication. So obesity discriminations can lead to mental issue among those who are overweight. Scientific data point to an increased risk of the low self-esteem, mood disorder, motivation disorder, eating disorder, poor body image, and interpersonal communication issue, all of which have a direct or indirect impact on life quality. So that's all from me. Thank you.
The next part of our study is methodology. Basically, methodology is a method that we use in this study, including the data collection and also data analysis to find out the objective of the study that will be conducted. To explain about our background study, basically our study will conducted at the Dickson District Health Office, which is there are 19 seats of staff on duty, and all the entire staff or population in this office we will take as our sample and respondent. Calculation of such sample is based on a study conducted by Ravi Kiran in 2022 that all the population were taken as a study sample. In general, the staff in PKD Dickson carry activities under public health program such as prevention and control of infectious diseases and also vector-borne diseases, law enforcement under public health, food quality and safety monitoring program, and others. Therefore, this is really important to them to have a high level of health and also good mental health, as well as to able to provide good quality while doing their job. The will conducted is a quantity study. Therefore, the data collection will be carried out in the field with the help of the medical team from the Klinik Kesihatan Daerah Dickson. The data collection involving into three methods. The first one is the body mass index measurement. The respondent weight and also height will be measured in order to find the respondent body mass index or BMI. Generally, BMI is classified into 4 categories. The first one is underweight, the second one is a normal, the third one is overweight, and the last one is obesity. While our study will focusing only into 2, which is overweight and also obesity. The reason why we choose only 2 categories from the BMI category, which is overweight and also obesity, this is because the previous study have shown that obesity and overweight is a serious health problem for the majority in Malaysia, as well as it can increase the risk of the serious element such as heart diseases, stroke, diabetes, cancer, and many else. The second data collection involving the measurement of the health status, which is we focusing only into 3 diseases. The first one is the level blood sugar, the second one is level of cholesterol, and the last one is blood pressure.
among respondents. Measurement of the level of sugar in blood, we will using the fasting blood sugar test. The second test, we using the lipid profile test to measure the level of the cholesterol and other fats in the respondent blood. And the last one, we using a spirometer to determine the respondent blood pressure. Last data collection was to find out the level of mental health among respondents through the distribution of the depression, anxiety, stress scale form. The dust form is used to measure the level of depression, anxiety, and also stress that we will divide it into normal, mild, moderate, severe, or very severe. The data were collected will be presented into a descriptive analysis in the statistically package for social science SPSS. A correction test will be run to identify the fourth and the fifth objective, which is to identify between the relationship between health problem and chronic diseases as well as mental health status among the workers in Dickson District Health Office. The last one is reference. Reference sources of this study used are from books, journals, and also internet. 24 references were taken during the preparation of this proposal of this study.